Hi everyone, it's Dr. Bishop here. This video goes over a validity checklist for systematic reviews. Let's review the case in the article that you found. You are a second-year student who is seeing patients at the student-run clinic. You see a 42-year-old woman who wants to know if she should get a mammogram to screen for breast cancer. You came up with this PICO question. In women between 40 and 50, do screening mammograms compared with no mammograms reduce the risk of death from breast cancer? The guideline by the U.S. Preventative Task Force is a bit confusing, so you decide to review the systematic review that was published in the Annals of Internal Medicine and that the guideline was based on. You plan on going through the 3 steps of critical appraisal to determine if you believe the results, what the results are, and how you might apply these results to patient care. In this video, we are going to go over the first question: are the results of the study valid? Like all of the validity checklists, the one for systematic reviews is available on the JAMA Evidence website. If you click on the User's Guide, and then click on Summarizing the Evidence in the right-hand column, you can find the checklist. Let's go through the questions. There are 4 questions for the validity criteria for a systematic review. First, did the review explicitly address a sensible clinical question? Second, was the search for relevant articles detailed and exhaustive? And third, were the studies included in the review of high methodologic quality? And finally, were selection and assessments reproducible? Let's focus on this first question. Did the review explicitly address a sensible clinical question? If you remember from the introduction video, a systematic review pools evidence from multiple studies and synthesizes that evidence either quantitatively or qualitatively. One problem is that the clinical question may be too broad. Consider a review where the authors pooled results for all cancer screening test trials and for all types of cancer and looked at the overall effect on mortality. It wouldn't make sense to pool all of those studies because the screening tests and their effects on mortality would widely vary. So it's important to know if the authors clearly defined a research question or PICO question, and for you to decide whether you expect the results of these pooled studies to be similar. That being said, like many research articles that you've reviewed, authors of systematic reviews may look at studies with different groups of patients, different outcomes, and different types of intervention, and often they will do subgroup analyses or a few different poolings. The first place we want to look at is the methods section, where the authors describe the criteria they use to include or exclude studies in the review. The authors write, "We included randomized controlled trials and updates to previously published trials of screening with mammography, MRI, CBE, which is clinical breast exam, or BCE, which is self-breast exam, with breast cancer mortality outcomes published since 2001. They also write, "We also reviewed meta-analyses that included studies with mortality data, and we excluded studies other than controlled trials and systematic reviews, or those without breast cancer mortality as an outcome." These seem like reasonable inclusion and exclusion criteria, but it is important to note that the age range was women from 40 to 69, and the screening interventions were mammography, MRI, clinical breast exam, and self-breast exam. The good news is that if we read further, we can see that the authors broke down this review into different subgroups, and the one we are most interested in, that is, breast cancer mortality reduction in women aged 40 to 49, is presented as a separate clinical question in the results section. Going back to our validity criteria, I will give this question a check mark. Moving on, the next question is, was the search for relevant articles detailed and exhaustive? This is a really important issue for systematic reviews. The authors need to make sure they found all the relevant articles and did not miss any. Let's see what they write in the methods section. In this section, they write, "We searched the Cochrane Central Register of Control Trials and Cochrane Database of Systematic Reviews and Medline for relevant studies and meta-analyses. We also conducted secondary references by manually reviewing reference lists of key articles and searching citations by using Web of Science." They also refer to an appendix with the search results. I've downloaded it so that we can review it. Here's the figure from the appendix. This type of figure is very common in systematic reviews, and I always look through it if I want to get a sense of what the authors found and what they decided to include or exclude. As you can see from the figure, the authors found 2,994 articles using their search criteria. Because it's nearly impossible to read through that many articles in a reasonable amount of time, the authors usually exclude articles based on a review of the titles or the abstracts. As you can see, the authors excluded 2,435 articles just based on abstract review. They then excluded 514 articles based on their inclusion and exclusion criteria. For the question about mammograms in women aged 40 to 49, the authors included 9 articles. Going back to our validity questions, it does appear that the authors did an exhaustive search of the literature for relevant articles. So let's give that question a check. Moving on, the third question is, were the studies included in the review of high methodologic quality? This question comes back to all the topics that you learned thus far in EBM. That is, your knowledge of study designs and validity criteria for different types of articles such as therapy, harm, prognosis, and diagnosis. And this knowledge is important to help you decide whether the authors of a systematic review included only high-quality studies, that is, studies where you believe the results. In addition to understanding the quality using your EBM techniques, writers of systematic reviews often use a number of systems to help them determine the methodologic quality. In this article, the authors described a predefined criteria developed by the U.S. Preventative Task Force to rate the quality of each study as good, fair, or poor, and they resolved discrepancies between 2 reviewers by using a third reviewer. They only considered articles that were rated fair or good quality in this meta-analysis. Another term that you might hear is something called the JADAD score, which is another system for scoring the quality of articles included in systematic reviews. As a reader, you would like to know first what system the author used to include articles, and second, did they exclude poor quality articles, and how did they do that? Going back to our questions, it does appear that the authors only included studies that were fair or good quality. So let's give that question a check mark. The final question is, were selection and assessments reproducible? For this question, I want to introduce you to a term called the kappa statistic. Often, title, abstract, and full text reviews are done by 2 people. The kappa describes the level of agreement about inclusion and exclusion of articles by the 2 reviewers. A kappa score of 1 means there's full agreement between the 2 reviewers. A kappa score of 0 means there's no agreement between the 2 reviewers. Usually kappa scores run between 0 and 1, and kappas of over 50% mean that there's a higher likelihood than chance that the reviewers agreed on the articles to include. The authors of this article do not report a kappa score for the different stages of the review, so it's unclear how much agreement there was about inclusion and exclusion. They do write that 2 reviewers rated the quality of each article, and a 3rd reviewer decided if there was no consensus between those reviewers. Going back to our questions, it's unclear to me whether the selection was truly reproducible, so I'll give this one a question mark. Now that we've completed the validity checklist, let's pull everything together. Looking at our full checklist, we can see that the authors explicitly addressed a sensible clinical question. They did an exhaustive search and included studies of high methodologic quality. It was unclear whether their selection of studies is reproducible. So the question is, are the results valid? Remember, validity is a spectrum. Studies can be weak, studies can be strong, or they may be somewhere in between. I would rate this study as pretty strong, given the validity criteria that were met. Now that we've decided that this is a strong study and we believe the results, it's time to interpret those results.